Consumer involvement in research is critical to the success of research. Back when I was a teenager, we had very little input into what was happening in research. So that was really being a participant or a guinea pig. And so I remember having a piece of skin removed for somebody to do some testing. I had no idea why, I just knew it was for research. These days, if I'm going to be participating in research, I want to know why the research is being done, what is my participation going to be required, and what are the answers, and how am I going to be fed back information or be involved in helping create the trial itself. The fact that we have consumers involved in all of our research in cystic fibrosis now actually leads us to a better outcome, because it's not just somebody thinking up, oh, here's a question I'm really interested in finding the answer to, which is how a lot of research has been done in the past, but to what does the community need, what is the things that we would like to see as an outcome, how are our lives going to be made different, and where does that intersect with science so that we can actually all get what we want out of it. So I think you get better research, you get better questions, and you also get better protocols, because sometimes people think, oh, this is what we should do, we should get our research subjects to do X, Y, and Z, not understanding what that actually means for the person. And if you have involvement in research, then we can say those protocols aren't going to work. No one's going to participate, or if they do, you're not going to get the answer you want because they'll pull out halfway through or do it only halfway. How do you know if it's good research? If the community doesn't think it's good research, is it good research? The community can look at what are the goals for us and how do we help the researchers help us achieve our goals, because that's really what the research is about, is achieving an outcome for community. The thing that surprised me about being involved in research is the sheer numbers of people who are doing it, the different research that's across the board. I understand now a bit better about, well, they have to be doing research, they have to get funding, and if they don't have funding, they don't actually work. And that's to the detriment of the community. Consumers being involved with those organisations help to make sure that you get better applications even, so that the funding does come and people are able to then continue their research. I would think for researchers, it's for the first time that they want to be getting involved with consumers, or even if they haven't thought about it, it's probably a scary thought, because it's another lot of people who are trying to tell you what to do, potentially. But I think for researchers, what they really are going to get is they're going to get a people who are invested, or more invested in some cases, in the outcome than you are, who can look at things from a slightly different angle. They're not trying to tell you how to do science. What they're trying to do is say, for that science to work, there are things that we need to happen as a community, or as the participants even. If you ask us to do X, X is almost impossible. But if you ask us to get the answers to X by doing Y, then we can actually help out. And you can actually have those conversations about what makes sense. We're not asking consumers to design the trials and design the research. What we're saying is, invite us to become involved and you will get better outcomes and better research. And maybe you'll help clarify the questions you're even wanting to ask. For new people involved in research, I think it can be quite daunting. Initially, many people are involved in research because they're participants. Having the confidence to understand that the things that you bring are different, but important. And sometimes your view is more important and sometimes it's less important, but it's always important. And I think it's people having the confidence and just taking small steps, getting involved. If there's a process and people want reference group members, put your hand up. You may think that there's nothing you can add, and then you'll be very surprised once the questions start asking, because you go, that makes no sense, let's do it this way. With organisations such as cystic fibrosis organisations, even providing them with information about what sort of research would you like to see, because they can then talk to researchers and they can talk to funders and help get the research that community needs done.